Welcome back. We're talking with Dr. Karadimas about shoulder disorders. Dr. Karadimas, what are the common disorders that you see in your office?
In my practice, and I see a lot of elective, non-traumatic injuries, traumatic injuries from sports, from athletes I see, but not a lot of, car accidents and things like that. I see more sports and more repetitive things and insults to the rotator cuff tendon, and that really overwhelmingly is the biggest patient population with shoulder problems that I see and most doctors see.
You talked about the rotator cuff being pinched. How does that happen?
Well, so essentially where the rotator cuff lies, I'm going to pull this model out one more time for you. The rotator cuff wraps around the ball here, wraps all the way around the ball, and above it sits this bone here called the acromion. And so there's not a lot of space between the two. It's actually kind of a sandwich. Your tendon sits right between this bone sandwich. And when your arm goes up, there's a chance that the tendon can get pinched from here or from other bones in this area. So the bone begins to pinch on that tendon, and it rubs it, and it can wear it or tear it.
Now, how do you diagnose a shoulder disorder?
Certainly, like most things, the first thing is going to be a physical evaluation. You're going to look for range of motion. You're going to look for tender spots. You're going to look for any weakness in the shoulder. What we typically don't see is like swelling and bruising, not in the shoulder joint. The second thing that you would do would be to get an x-ray. Certainly the x-rays aren't going to show you the most problematic areas, the cartilage, the ligaments, the tendons, but they do give you a good idea of the bony architecture. They give you an idea if there's any arthritic areas. They give you an idea if there's any spurring that's occurred. And you never know, you might run into an unusual problem with a cyst or some other type of problem that you're not going to be able to see unless you get an x-ray. At the end of the day, if you truly have a non-bony problem, and again, most of the time we're talking about rotator cuff tendon problems, an MRI is going to be your best way to actually look at the tendon without looking at the tendon physically, getting a good image of that tendon. And when you do that, you certainly are able to see other non-bony structures in the shoulder, cartilage, ligaments, capsule, things like that.
What are some non-surgical treatment options for shoulder disorders? Traditionally,
it would be oral anti-inflammatories, Motrin, Aleve, Advil, or prescription strength. Physical therapy, and steroid injections, cortisone injections. Now I'll tell you, in today's day and age, as we get further advanced in what we do and try to really focus down at the problems and limit side effects or other problems that can occur, we're getting away from anti-inflammatories. Certainly they're still very popular, and I think if you were to go to a lot of doctors or a lot of other medical people, they would probably tell you to take an Advil or take a Motrin. But that's really a systemic sort of thing. You're trying to get anti-inflammatories to a very small area by taking it and it going through your whole body. And in the tendon and the bursa and things around the shoulders, you don't get high penetration. So we try more targeted approaches. Certainly I would recommend a steroid injection, which is basically like a super Motrin, right where the problem is, like a targeted, instead of carpet bombing, using that, that cruise missile, right for the problem. And then people would say, well, how does physical therapy work? Well, what happens is actually, as the shoulder becomes irritated, as that tendon becomes inflamed, the muscles around the shoulder begin to weaken. And if you could strengthen them up, you could really kind of sock in that ball and stabilize it, and that can very often prove to be helpful.
Are there times when a cortisone injection might not be a good idea, where maybe the person is using their shoulder more and actually doing detriment to their shoulder?
Well, that's a very good question. I mean, and certainly that is something that we always think about, because you can cover it up a little bit with cortisone. Let's say you have a tear in the tendon, or the rotator cuff tendon. That is not going to heal up, no matter what unless you go in there and surgically fix it. And you could cover it up by putting cortisone in there, make it feel better. And over time, since it won't heal, it's going to continue to tear. So you could mask that problem. In my practice, what I do is if I have that kind of index of suspicion, I think that there's a remote chance you have a torn tendon, I'd always get the MRI first. And then if there is a torn tendon, I would tell somebody, it should be fixed. But depending on the time frame, it can wait 6 months if you wanted to wait. And if they're very painful, I'd give them the cortisone shot, but let them know that this is to cover it up, to make you feel better, because at some point in time, we should fix it. Certainly, if I thought that it was just a tendonitis problem, I would probably go for the cortisone shot. And, you know, if I'm not worried about there being some tear or something that's going to cause further damage, then I would just try with the simple things first.
Dr. Karadimas, this is great information. We need to take a break now. When we come back, we'll talk about some surgical treatment options.
Great.